11 big moves in maternal health care here in the Hoosier State. A recent change allows women to continue Medicaid benefits for a year after giving birth. Now, in the middle of Maternal Suicide Awareness Week, that change has become permanent. WRTV's Kayla Molander explains.
Also, we are saying that you matter. You matter.
About 39% of births in the state of Indiana are covered by Medicaid. Until this year, those mothers typically lost their coverage 2 months after giving birth. But now that coverage extends for an entire year.
Indiana is known to have a maternal mortality crisis. We have the third highest maternal mortality rate in the nation.
As part of the American Rescue Plan, the federal government offered states the extended coverage starting in January. Representative Maureen Bauer out of South Bend wrote a state law that makes the change permanent. That law passed unanimously. Yesterday, the federal government approved it.
The only reason why you aren't seeking care is because you can't afford it. It's tragic, and it's something that we just shouldn't allow to be acceptable in our state.
That federal approval comes in the midst of Maternal Suicide Awareness Week. Tyree Reed founded her nonprofit Shades of Becoming a Mom last year. She's excited that moms can now access mental health services for much longer.
I actually personally suffered with postpartum depression. I had a very traumatic birthing experience. And so, although I didn't have suicidal ideation, having that extra support from a medical professional really does help.
Data on maternal suicide isn't officially tracked, but recent numbers suggest that suicide may be one of the leading causes of death in young moms. Nonprofit 2020 Mom says that suicide in new moms is the most common, 6 to 12 months after delivery.
There are so many great benefits beyond just the woman being alive, but also that we have a healthy baby with a healthy mom that is surviving and making it past that first year of life as well.
Working for you, Kayla Molander, WRTV.